Thank you, Chairwoman McLean. We've done some really good hearings together this year. We've come together on a bipartisan basis to uncover the root causes behind the infant formula shortage. We've pointed out how bank regulators need oversight, and we've dug into the role of Chinese money laundering organizations in making the drug cartels rich. What do all of these things have in common? We've tackled real problems: deaths from fentanyl, scared parents unable to feed their babies, risks to our financial system. We've shown we are willing on a bipartisan basis to hold powerful people to account. We identified places where we need guardrails to make our government, our economy, and our country work better. And though we didn't agree on everything, we came together on the big picture to achieve progress. I'm afraid that none of those things are true for today's hearing. Today, we are here to discuss a proposed rule from the Biden and Harris administration that would expand health coverage to everyone lawfully present in the United States. Medicaid and the Affordable Care Act plans are already available to people who are lawfully present in the U.S., but under current federal rules, Dreamers are left out of the definition of lawfully present. President Biden's proposed rule changes that. Why would the president do that? Because, well, DACA recipients are, in fact, lawfully present in the United States. How? Because Congress passed the DACA law. There's not a whole lot else to unpack. So what are Republicans trying to do with this hearing? It is an oversight, because the ability to go to the doctor isn't an abuse of power or an evasion of the law. The title of this hearing gives a clue: why expanding Medicaid to DACA recipients will exacerbate the border crisis. Let's look at the premise here. First, some facts. Many DACA recipients already have health coverage through their employers, just like other working-age Americans. Dreamers work hard, pay taxes, and they get employer-provided care. So how many Dreamers would even get Medicaid under this new rule? About 13,000. About the size of one small town. And then the other Dreamers would be able to buy, using their own wages, health care on the exchange, just like anyone else who lives and works here in the United States, and do so in compliance with the law. Somehow, letting people who legally live in the United States buy health care is going to create a border crisis. It'd be funny to watch this bad argument fall apart if it weren't such a waste of time. This subcommittee has had great hearings under Chairwoman McLean's leadership, hearings that held powerful people accountable, identified missing guardrails, and improved the lives of the people we serve. This hearing doesn't meet those standards, because what powerful people are we holding to account here? The people who would get health care under this rule aren't rich or well-connected. These folks aren't using their powerful positions to abuse the system. They're just regular workers trying to get insurance so they can stay healthy. Okay then, so what missing guardrails are we identifying? None. This hearing isn't about putting up guardrails. It's about ripping away a safety net. It's telling people who have followed the rules of the DACA program that they can't access health care. Okay then, so how does this hearing make life better for our constituents? All I can say is when you're making it harder for people to be healthy, you're gonna have a tough sell that you're in it for the people. And honestly, I think that's why this hearing is framed to be about the border. Most Americans want healthy communities. Most Americans want Dreamers to have a future in our country. But too many Republican lawmakers don't want either of these things. And they know they're not gonna convince the people by arguing against popular policies like accessible health care. So instead, they're bringing in buzzwords like border crisis to try to save the day. Republicans need to be able to defend the real reasons that they continue to oppose health care expansion, if this is the hearing that they want to have. Otherwise, I hope we'll go back to having serious oversight hearings. I've seen that the Republicans can do it, and the American people deserve no less. I yield back.